Medicare can sometimes feel like alphabet soup. You got A, you got B, you got C, you got D. You may have even heard of F and G and N. But once you know what each letter stands for, the whole picture starts to make sense. So today we're going to walk through at a high level what Medicare really covers and maybe some ways to be able to avoid any surprises that you might run into in retirement. Teachers, you give so much every day. You're shaping lives and you're inspiring the future. But when it comes to your retirement, the path forward can feel uncertain. If you're an educator juggling demands of busy schedules and financial stress, you are not alone. Many teachers worry about outliving their savings, or managing their pension, or ensuring long-term care without burdening their family. With pensions often alone falling short, many educators struggle to bridge the gap between what they need and what they have for a secure retirement. That's where Educators Financial Foresight Weekly comes in. Each week, I'll guide you through clear, actionable steps to understand your pension and spot hidden gaps, build retirement income strategy tailored to your needs, protect your savings from inflation and unexpected costs, and plan for long-term care and estate needs without burdening your loved ones. Your career has been about making a difference. Tune in every Thursday at 11:30 a.m. Eastern on YouTube and LinkedIn. Let's build a retirement as rewarding as your career. Welcome to this week's episode of Educators Financial Foresight Weekly. I am your host, as every week, Debbie Major, your educator turned financial professional. This week I want to do an overview of Medicare because even if you have health insurance offerings through your pension fund, you still have to sign up for Medicare and you still want to have a basic understanding of what it is and what your options could be and when to do it. So we're going to start today just going over some of the options that you have. All right, so you can kind of think of Medicare like a kind of a class schedule because Part A is your hospital. This is what keeps you from catastrophically running out of money if you had to go to the hospital. This is what you pay your taxes in every year through your paycheck. So most people do sign up for Medicare Part A when they're 65. And that's because Part A doesn't cost anything, and they'll work with the insurance company that you have will work with Medicare to pay those big hospital bills. It mainly covers hospital and hospice. That's what takes over if you needed hospice care, and the skilled nursing care if you're in the hospital and you have to go to rehab for skilled nursing. Medicare Part B is the one that you use all the time. This is your medical insurance. This one is taking care of your doctor visits and your tests that you might need to have done or rehab that you're going to. All the things that we really usually use day to day in our medical needs, that's what's covered under Part B. Now, Part B does have a premium that you have to pay when you sign up. So you want to be careful about when you sign up for it. And if you don't sign up for it at an appropriate time, there is a penalty that's involved. So you want to watch out for when you can sign up and when you can't. And we'll go over that next. So we have A, hospital, B, medical. And those were really the two that were the original Medicare. Now we have a Part C and a Part D. And I'm going to skip Part C for 1 second, and I'm just going to talk about Part D for a minute. Part D, you can think D and drugs. This is your prescription coverage. This is required and has another penalty involved if you don't sign up when you turn 65. The way that the prescription plan runs is you have to buy it individually from an insurance company. They're not offered from the federal government, and they won't send letters to you saying you must sign up for this by some specific day. So you have to know, I need to get a prescription plan, make sure I have prescription coverage in whatever plan I take with Medicare. Now, you'll see there's lots of moving parts for Part D, but it's good to know that there might be a deductible where you have to pay the first certain amount of the drug cost.
Then you're going to go into a phase called initial coverage, and that's where you have co-pays or co-insurance depending on what level your drugs are on. And then once you meet a drug spend yourself in 2026, I'll say, since that's coming up, of $2,100, then you're done paying your member drug prices for the rest of the year. So that Part D is a little bit probably the more complicated that people see, because it looks, your prescriptions will be on different tiers in your Part D plan than they probably were in your employer plan. So it's really important that you know your prescriptions and you put them into Medicare.gov correctly, or you have an agent help you do that. Now that's A, B, and D. Those are the 3 requirements that you really have to have for Medicare so you don't get any penalties or anything. Part C is called Medicare Advantage plans. And I usually say, these are the ones where you see advertisements every year from the insurance companies, because these are all offered by private insurance companies. And what they do is they replace Medicare, or you get it instead of using original Medicare. And so you get A, B, and usually Part D coverage all in one plan. So you either stick with original Medicare or you get a Medicare Advantage plan. Each part has a role, and you want to think about how they work together. So the next question is then, when do I sign up for Medicare? So age 65 is the big age for signing up for Medicare. If you are retired at 65 and you are receiving Social Security benefits, they will automatically send you your Medicare card. Most people, if they're still working, will only get Part A. An exception is if you have a health savings account. If you are actively putting money into that, or your employer is putting money into that because you have a high deductible health plan, then you don't sign up for anything until you retire from your work. But for most people, they will sign up for Part A even if they're still working and even if they have employer coverage. Part B, you have the option to sign up for. Everything is signed up for through SSA.gov, Social Security Administration. So make sure you have that My Social Security account set up there so you can log in and do your applications. Now, Part B, you want to enroll in that either when you turn 65 if you're retired, and that will have the premium. That premium can come out of your Social Security check, or if you're not taking Social Security, and then they'll send you a bill. You can pay it by bill. This is called, when you turn 65, your initial enrollment period. And it actually constitutes 3 months before you turn 65, that month you're 65, and 3 months after you turn 65. And it's a 7-month window where you can sign up for any plan. They can't ask you any health questions. There's nothing else involved. You get coverage starting the month that you need it. Now, if you are working at 65 and say, I'm not going to retire until 67, or I might not retire until 70. What you will most likely want to do is sign up for Part A now, get your Medicare number, and then when you decide you're going to retire or you're going to come off your employer plan, either one, then that's when you're going to go into the Social Security website and you're going to apply for Part B. You want Part B to start the first of the month after your employer coverage ends. So it's all coordinated together. When you sign up for that Part B, no matter when it is, you want to make sure you sign up for Part D, that prescription plan I was just talking about. And make sure you sign up for a Part D, and then you know you're covered no matter what. So either if you sign up for a Medicare Advantage plan, or you've got retiree health plan that includes prescriptions, then you're okay with it. It's called creditable coverage. And Medicare, the government needs to know and wants to know whether you've had prescription coverage since you turned 65 till whenever you decide to take it. And because that's how they base their penalty. And it's separate from Part B, which would be your employer health coverage will as long as it's as good as Medicare, you'll be okay, and that's what you'll say you have. And your employer will fill out a form saying this is what you have. You've got this employer coverage. All right. I hope that made sense. I feel like I'm talking in a couple of different directions. But the most important thing to know is if you sign up at 65, there'll be no penalties if you sign up for everything, because people usually worry about penalties. If you are working and you wait to sign up for Part B and Part D, your medical insurance and your prescription insurance, then you'll just coordinate it with the end of your employment period so you're not missing anything. Then you're not going to get a penalty either. The penalty only applies if you don't have any coverage and you don't sign up for anything. Then when you do sign up, that's when there would be a penalty. For most people, they won't incur it if they follow those directions. There's lots of agents out there ready to help, along with YouTube videos, however you like to get your information. But you want to make sure you're clear about when you want to sign up and how you want to coordinate that end of that employment coverage to when your Medicare starts right the next month. All right, so just to kind of recap a little bit, Medicare is a strong foundation. It doesn't cover everything, and there are gaps. For example, there is a deductible for your hospital insurance. There is a deductible for the medical insurance, Part B. There are co-insurance payments where you pay a % of the cost that it costs. And there's co-payments where you pay a fixed amount for things. So you want to make sure you go over all of the ins and outs of the Medicare parts and make sure that you can do it, because they can add up. And so you want to figure out ways to make that gap smaller if you can. And the ways would be either to get a supplement plan, which would be a Medicare supplement plan that covers the gaps. I like to call it the Medigap plan. It covers the gaps that Medicare's not paying. Or you look at the Medicare Advantage plan, where you've got more predictable co-payments and co-insurance that you know exactly what you're going to pay when you go to the doctor or the hospital. But that's why you want to learn and you want to go over all of your options. And usually I say, don't wait till the month before you know you need to sign up. A couple months before, get together with someone, go over what all the options are so that you can sit and think about it for a while and decide what you're most comfortable with, and you're not pressured into going one way or another. And then you're confident on what you decide that you want to do. All right. Rookie's quote this week is, "An investment in knowledge pays the best interest," from Benjamin Franklin. And you joining us each week and learning things from here and listening, you are investing in knowledge, in your own knowledge. So you're going to get great interest. And I appreciate that. And I want to thank you for joining us each week and for your feedback and just for being there and doing what you're doing. All right. So there you have it for this week. The ABCs and D of Medicare. When you understand what each part does, you can take control instead of being controlled by confusion. If this episode helped to simplify things, I encourage you to check your own Medicare timeline or share this with another educator who's nearing retirement. A little clarity now can save a lot of stress later. And remember, you don't have to figure it out alone. That's what I'm here for. Our firm does help with Medicare people every single year. You can always read the Teacher's Roadmap or message me directly for help reviewing your options. All right. Well, have a wonderful week. Thanks again. Please like and subscribe and join us and give your feedback. I'd love to hear from you on things you might want to hear in upcoming topics or what you thought about today's. All right. Have a good one.